Governor Baker signs legislation to combat the opioid crisis. The bill sets new time limits on prescriptions for highly addictive painkillers. There would also be provisions on evaluating people treated for overdoses, along with new prevention efforts for physicians and students.
I loved her, and I tried everything I could to help her. But Liz died of an overdose. She died of a disease, one not that very different from cancer or heart disease or diabetes or AIDS, one that deserved equal treatment and dignity.
I bring kids to hospitals, treatment centers all day, and you got to coordinate with their families and get them into a spectrum or another facility. 24 hours just doesn't cut it. And the 3 days would make a huge difference. They could probably wean off of the opioid use. I think that's the most important bill that has to be addressed in the future.
We all recognize that this legislation will not bring your loved ones back. But I want you to know, and I hope that you find some measure in comfort knowing that today there is legislation that is going to change the course for other families, for other individuals in the state.
Young people are at such a high risk when they're around some of the drugs that are around on the street today. And they just haven't had the information, they haven't had a chance to have that discussion, and we owe it to them to try to provide them that education and that information.
We think that this is a positive bill all the way around. It should work from a prevention perspective with the schools, with limited prescriptions hitting the street, and create more access and more recovery options for those seeking services.